Did you know that over 40% of adults over 50 wake up at least twice during the night to go to the bathroom? And the most surprising thing, many believe this is normal, just a natural part of aging. But I have news that will change your perspective. There's nothing natural about having your sleep interrupted repeatedly. In fact, this seemingly harmless habit can be silently destroying your health, impairing your memory, and even increasing the risk of serious illnesses. Today, I'm going to reveal what no one has told you about the real causes of nighttime urination, scientifically called nocturia. We're going beyond the superficial tips you find out there. You'll discover how certain innocent foods from your dinner, the timing of your medication, or even that nightly cup of herbal tea you drink to relax can completely sabotage. And most importantly, I'm going to share with you a set of 8 simple steps, all scientifically validated, that can give you back entire nights of uninterrupted sleep. Sounds too good to be true? Then keep watching, because your life is about to change. Dr. Alexander King, Restoring Quality of Life Through Integrative Medicine. Let's start by understanding what really happens when you wake up several times during the night to urinate. Nocturia isn't just an inconvenience, it's a warning sign from your body. When you wake up repeatedly to go to the bathroom, your sleep cycle is disrupted, preventing you from reaching and maintaining the deepest and most restorative stages of, especially REM sleep. The studies are alarming. Recent research from Stanford University shows that people with nocturia have a 50% higher risk of developing long-term cognitive problems. Why? Because it's during deep sleep that your brain consolidates memories, repairs tissues, and eliminates toxin. Each interruption compromises this vital process. But the problem goes beyond just feeling tired the next day. The chronic sleep fragmentation caused by nocturia is associated with a higher risk of hypertension, diabetes, obesity, and even depression. A study published in the Journal of Clinical Sleep Medicine revealed that people who wake up 2 or more times to urinate have an 80% higher risk of reporting low quality of life. And here's something few doctors mention. Frequent nighttime urination can be both a cause and a consequence of a vicious cycle of health. The more you wake up, the more your body gets used to this pattern, making it increasingly difficult to break the cycle. Have you ever noticed how you feel the day after an interrupt? That feeling of brain fog, irritability, or lack of energy? These aren't just impressions, they're real biochemical effects of sleep deprivation caused by nocturia. Do you identify with this problem? How many times a night do you usually wake up to go to the bathroom? Now let's uncover the real culprits behind nighttime urination. Yes, reducing fluids before bed helps, but that's just the tip of the iceberg. There are much more subtle and potent factors that may be affecting you. First, let's talk about what I call dinner saboteurs. Certain seemingly harmless foods can have a significant diuretic effect if consumed at night. Did you know that tomatoes, present in so many dinner sauces and salads, contain natural acids that can irritate the bladder and increase urine production? The same goes for citrus fruits, chocolate, spicy foods, and surprisingly, even certain vegetables like asparagus and celery. Another often ignored factor is the circadian rhythm of your hormones. Normally, your body produces more vasopressin, a hormone that reduces urine production during the night. As you age, or due to chronic stress, this production may decrease, resulting in a larger nocturnal urine volume. It's a biological explanation that many specialists overlook. What about your medications? Many common medicines may be silently contributing to the problem. Diuretics for high blood pressure are the obvious culprits. But did you know that antihistamines, certain antidepressants, and even supplements like magnesium and vitamin C in high doses can increase urinary frequency? And most importantly, the time you take these medications can make all the difference. I'll share the case of John, a 62-year-old patient who came to my office desperate after years of waking up 3 to 4 times a night. His exam showed no problems with his prostate or bladder. What did we discover? John took his blood pressure medication at 8 p.m., just when he should have been preparing his body for sleep. In addition, his innocent nightly chamomile tea contained a blend with diuretic herbs. After adjusting these factors and implementing the steps I'm going to show you now, John started sleeping through the night in just 2 weeks. Have you analyzed your nightly routine for these hidden saboteurs? Any medications or foods that you consume regularly at night that may be worsening the problem? The moment you've been waiting for has arrived. The 8 scientifically proven steps that can transform your nights. Remember, these strategies work much better when applied together, creating a powerful synergistic effect on your hormones, kidneys, metabolism, and nervous system. Step 1. Strategic fluid redistribution. It's not just about reducing fluids at night, but about intelligently redistributing them throughout the day. Studies from the Mayo Clinic show that 70% of your hydration should happen before 4 p.m. Create a decreasing schedule: 16 Oz of water upon waking, 13.5 Oz in the mid-morning, 10 Oz at lunch, 6.7 Oz in the mid-afternoon, and only small sips after 6 p.m. This will train your kidneys to filter more during the day and less at night. Step 2. Bladder retraining. Your bladder, like any muscle, can be trained. Start retaining urine during the day for gradually longer periods, always respecting healthy limits, without feeling discomfort. Studies from the University of Michigan demonstrate that this bladder training can increase its capacity by up to 30% in 2 weeks, significantly reducing nighttime episodes. Step 3. Nightly eating protocol. Eliminate the big 5 after 5 p.m. Caffeine, including chocolate, alcohol, spicy foods, tomatoes, and citrus fruit. Replace them with foods that help with natural melatonin production: cherries, kiwi, walnuts, almonds, and brown rice. A Japanese study demonstrated that this protocol reduced nighttime urinary frequency in 65% of participants in just 10 days. Step 4. Applied chronopharmacology. Step 5. Lower limb elevation. During the day, especially if you spend a lot of time standing, fluid accumulates in your legs. At night, when you lie down, this fluid returns to circulation and ends up in the kidneys, generating more urine. The solution? 20 minutes with your legs elevated above the level of your heart before bed. A Dutch study proved a 40% reduction in nighttime urine production with this simple technique. Step 6. Diaphragmatic breathing to reduce abdominal pressure. Deep breathing using the diaphragm for 5 minutes before bed reduces pressure on the bladder and activates the parasympathetic nervous system, responsible for rest. Researchers at the University of São Paulo demonstrated that this practice decreased nighttime urinary urgency in 35% of participants in just 1 week. Step 7. Strategic supplementation. There are specific nutrients that can help. Cranberry extract, not the juice, which is diuretic, can reduce bladder irritation. Vitamin D and magnesium glycinate help regulate the biological rhythms that control urine production. And extended-release melatonin not only improves sleep, but also acts on receptors in the bladder, reducing its nocturnal hyperactivity. Always consult your doctor before starting any supplementation. Step 8. Sleep reconnection. If you wake up to urinate, this protocol: minimal light, use red light, keep your eyes half closed, breathe slowly, counting to 10, and upon returning to bed, lie in the fetal position on your right side for a few minutes before returning to your usual position. Neuroscience studies show that this method helps your brain quickly reconnect with the previous sleep cycle. Have you tried any of these strategies before? Which of these 8 steps do you think will have the greatest impact? The benefits of eliminating nighttime urination go far beyond simply not having to get up during the night. Let's understand how these changes can completely transform your health and quality. First, let's talk about what happens to your brain. When you can sleep without interruptions, especially during the REM sleep phase, your brain performs crucial cleaning and organization processes. The glymphatic system, a kind of cleaning system, removes toxic proteins like beta amyloid and tau, associated with neurodegenerative diseases. Studies from the University of Rochester have shown that a single night of fragmented sleep can reduce this cleaning by up to 40%. The improvement in memory is another extraordinary benefit. Mary, a 58-year-old retired teacher, implemented my protocol, and after 3 weeks, in addition to no longer waking up to urinate, She reported a surprising improvement in short-term memory. This isn't a coincidence, it's science. Uninterrupted sleep allows for the proper consolidation of recent memories. Your immune system also celebrates when you eliminate nocturia. During deep sleep, your body produces and releases cytokines, proteins that fight inflammation and infection. With full nights of sleep, you naturally strengthen your defenses. It's no wonder people with interrupted sleep catch colds 3 times more often, according to research from the University of California. And if you're looking to manage weight or blood sugar, I have good news. Uninterrupted sleep optimizes the production of leptin and ghrelin, hormones that regulate hunger and satiety. In addition, it improves insulin sensitivity. Studies show that people with fragmented sleep have significantly higher blood sugar levels the next morning, even without changes in diet. There's also a profound impact on marital relationships. Carl and Ann came to my office not because of health problems, but because sleeping in separate bedrooms due to Carl's nocturia was affecting the couple's intimacy. After implementing these 8 steps, not only did Carl stop getting up during the night, but the couple reported a renewed connection and greater satisfaction in the relationship. Have you ever noticed how your mood, energy, and relationships are when you don't sleep? How do you imagine would change within time? Before we conclude, I want to address some obstacles you may encounter when implementing these changes and how to overcome them effectively. The first challenge is consistency. Many people experience improvements in the first few nights, but then relax in their practice and the symptoms return. Remember, the first 21 days are crucial. New neurological. Use a sleep diary to track your progress and stay motivated. Note how many times you woke up, what you ate for dinner, and how you felt upon waking. This visual record is extremely powerful for maintaining commitment. Another common obstacle is resistance from family members. Doctor, my wife keeps offering me chamomile tea before bed, reported Ron, a 67-year-old patient. The solution? Involve your family in the process. Share this video with them. Explain that it's not being picky, but science. When your loved ones understand that these changes significantly impact your health, they become valuable allies. There's also the challenge of social exceptions, dinners out, celebrations, travel. You don't have to be radical to the point of refusing invitations, but you can be strategic. At social events, opt for water with lemon instead of alcohol. Choose less spicy meals. And if possible, schedule these events to start earlier. An effective technique is what I call pre-compensation. On days with social events, be even more rigorous with the protocol during the day. What if you have other health problems? Conditions like diabetes, hypertension, or heart problems can complicate the control of nocturia, but don't be discouraged. Adaptations can be made. For example, diabetic patients who implement Step 3 with special attention to the glycemic index of nighttime foods report even more significant improvements. Finally, if after 30 days of rigorously following the protocol you still don't see satisfactory results, it may be time for deeper investigations. Undiagnosed sleep apnea, small asymptomatic urinary infections, or subtle hormonal imbalances may be hindering your progress. An integrative doctor can help identify these underlying issues. Can you identify which of these obstacles may be the biggest challenge in your case? How do you plan to overcome it? We've reached the end of our journey today, but this is just the beginning of your transformation. Recapping what we've learned, nighttime urination isn't a minor inconvenience or an inevitable part of aging. It's an important signal from your body that, when ignored, can seriously compromise your long-term health. You've discovered that the causes go far beyond simply drinking water. We've seen how certain foods, medications, the timing of your hydration, and even your breathing have been silently contributing to this problem. More importantly, you now have in hand a complete protocol of 8 scientifically validated steps: strategic fluid redistribution, bladder retraining, nightly eating protocol, applied chronopharmacology, lower limb elevation, diaphragmatic breathing, strategic supplementation, and sleep reconnection. What differentiates this protocol is that it doesn't just treat symptoms, it addresses the root causes of the problem, working with your body's natural physiology, not against it. And remember, The combined application of these steps creates a powerful synergistic effect that can transform your nights and, consequently, your day. The case of John, whom I mentioned earlier, illustrates the potential of these changes. After years of waking up 3 to 4 times a night, John now enjoys 7 to 8 hours of uninterrupted. Dr. Alex, he told me, it's not just the sleep that has improved. It's like I've gotten my life back, and that's exactly what I wish for you, the complete recovery of your well-being, energy, and quality of life. If you got value from this video, I ask for 3 simple actions. First, subscribe to the channel and turn on the notification bell to receive content like this regularly. Second, share this video with family and friends who may be silently suffering from this problem. You may be changing someone's life. And third, leave in the comments which of the 8 steps you will implement first and what are your main questions. I personally read all the comments and use your questions to plan the next videos. Always remember, small changes implemented consistently lead to profound transformation. Full nights of sleep are not a luxury. They are your right and a fundamental pillar of your health. I'm Dr. Alexander King, and here you find information that transforms. Until the next video.